Here's what's being left out of the longevity conversation. Heart health. Cardiovascular health predicts overall longevity better than cancer risk. When you think about heart disease, it remains the leading cause of death in the United States, exceeding all cancers combined. Yes. And people who reach midlife with optimal heart health live significantly longer, and they spend more of those years free from disability. So it's not just about longevity, right? Longevity is less about avoiding like one particular disease and more about preserving life action, blood flow to each of your organs for as long as possible. When we think about vascular aging, we need to understand that it drives aging of the brain and dementia. Reduced cerebral blood flow and stiff or narrow arteries are going to help cause cognitive decline. High blood pressure in midlife is one of the strongest predictors of vascular dementia and Alzheimer's disease later in life. And we got to think about it. The brain is very sensitive. It's very sensitive even to small reductions in oxygen delivery. So it's important that we protect our heart, because when we protect our heart, it also protects our memory, our decision making, and our independence. Longevity needs to encompass heart health in the conversation. Another thing that needs to be addressed in the longevity conversation is inflammation. Inflammation is a major driver of heart aging. Chronic low-grade inflammation changes the endothelium, and that's the delicate lining of our blood vessels. Elevated inflammatory markers, specifically like hsCRP, are independently associated with higher cardiovascular mortality, even when cholesterol levels might be normal. So stress, poor sleep, and metabolic dysfunction are major inflammatory triggers. It's important to know that. Heart disease is not just about fat accumulating in your arteries. It's about ongoing vascular injury. So when we talk about longevity, make sure you're not leaving the heart out of the conversations. It's Dr. Erica R. Jones, MD. Like this video if you learned something new. Comment below if you already knew this. And send this video to someone who needs to hear it. Thank you.